I'm speaking with Professor Miguel Garcia from the University of the Americas about a paper that he recently published in Rural and Remote Health titled Massive Testing in the Galapagos Islands and Low Positivity Rate to Control SARS-CoV-2 Spread During the First Semester of the COVID-19 Pandemic, a story of success for Ecuador and South America. Congratulations, Miguel.
Thank you. Thank you very much, and thank you for this opportunity to talk.
It's wonderful to talk with you. I wonder if you could first introduce the research team.
Okay, yeah, the research team, it was actually a multidisciplinary team composed, first of all, for the government of Galapagos, who was the one who could manage logistically that we could get there to set a lab for COVID testing in the Galapagos Islands. So that was one of the first stakeholders. Then we have the Ministry of Health, who actually is the responsible for COVID-19 surveillance and control in Ecuador. And in the case of the Galapagos Island, it was an exception. So they were in charge of the sample collection and individual selection to be included on the surveillance program. And then we have the collaboration between the Agency for Biosecurity on Galapagos Islands, that is dependent on the Ministry of Environment, and the University of the Americas. We are partners for a long time ago, these last two institutions, on several One Health projects that we have. And we collaborate now to set the lab for COVID testing using the infrastructure that the ABG have in Galapagos, plus the personnel and equipment that the UDLA provided. So that was pretty much, we were the two main partners taking care of the lab testing itself. So that was pretty much the research team involved on the testing, with the other partners involved on the sample collection and surveillance.
Fantastic. And how did this study come about?
Well, the study came about due to the long-time collaboration that we have with this institution in Galapagos Island, the Agency for Biosecurity. That is the institution who take care of domestic animal health. So we were working before on several One Health projects, monitoring, infectious diseases on Galapagos cattle and dogs that could affect not only the human population there, but also the wild animals living in Galapagos, that they are iconic and some of them endangered. So on that context of working together, COVID pandemic started, and we were requested to help them to set a laboratory for COVID testing located right there in the Galapagos Island. That is, a province of Ecuador, located 1,000 kilometers on the middle of the ocean, no? And that when there was no capacity at the beginning of the pandemic to do the PCR testing for a COVID-19 diagnosis. So that's how everything is starting about. The necessity of having a lab on site was clear, and as we were working before in other projects, we were contacted by them, and we planned together to put all what was needed to have the lab set it in the Galapagos, and that's what we did. Yeah.
And this was right at the beginning of the pandemic in 2020.
Yeah. The pandemic, the first case in Ecuador was detected in February 29, 2020. The first case in Galapagos was sometime along March 2020, and by April 6, 2020, so we are talking about 5-6 weeks after the first case in Ecuador, we were already doing PCR testing on site on the island. So it was, we were pretty efficient on getting everything down and ready on a short time. Yeah.
So what did you find? I suspect we know the answer because of the title of your paper, a massive success story for Ecuador. So yeah, just tell us about it.
Yeah, we pretty much, attached to WHO recommendations. And we were able to prove that even on a remote location, on a low and middle income country like Ecuador, if you do things right, you can pretty much achieve the same goals that were achieved in Northern European countries, for example, in terms of positivity rate. So that was the key. So WHO always recommended a low positivity rate below 5% That means that of all the population that you test, less than 5% have to be positive in order to have a proper testing ratio to control the pandemic. So, in other words, if you do a test and 80% of the population that you test are positive, that pretty means that you probably are missing a lot of positive cases in the population because you are not testing enough. But if you have a low positivity rate, that means that you are making enough tests to catch as many positive people and isolate them as possible. And that will happen in Ecuador, because in Galapagos, sorry, not in Ecuador, actually it was a completely different scenario. In Galapagos, we have that. We could have a lab on site for a 25 to 30,000 people population, and we were able to track down all the positive cases and the direct contact, test them and isolate them, support the Ministry of Health with this local testing, high testing capacity, and that allowed that by June 2020, actually the Ministry of Health declared Galapagos free of COVID, okay? So during 2020, when we have all this high testing capacity and these flight controls to arrive there and lockdowns, the pandemic was pretty well contained, okay? With the same standard of the countries that could success in other part of the world, mainly high income countries. So we were able to reproduce that locally in a remote location in the middle of the Pacific Ocean and in the context of South America. So that's what we are pretty proud of that, yeah.
Oh, absolutely. That's definitely something to be proud of. And I imagine it was quite different on mainland Ecuador at the time.
Yeah, it was quite different. I mean, we have a few publications showing a completely different scenario. I mean, in any other way, Ecuador, even remote location, as remote as, indigenous from the Amazonia isolated communities, we were able to detect their massive outbreaks of COVID-19 during the first semester of the COVID-19 pandemics. And it was because of that, because there was no testing on site, there was no, a high testing capacity. Ecuador didn't have a high testing capacity. I mean, the whole public health system relied on less than 5 tests daily for a 17 million population. And, our colleagues from the Ministry of Health, they did their best, but, with the resources that they have. Our experience on the first months of the pandemic on mainland Ecuador, we found the community transmission happening in remote and rural locations that we were able to visit and assist. And the situation was completely different than in Galapagos, and was no way to contain that. Okay.
Yeah. So what would you say are the key lessons in case this ever happens again? What do we need to focus on?
I mean, the key lesson and what we have to do is listen to the global health authorities. Like the WHO was talking pretty clear from the very beginning. Tests have to be done massively. So Dr. Tedros Adhanom was saying the same. You have to test and test and test people. I understand the problems of and issues of the low and middle income countries, but this is a call for the high income countries too. So I mean, if you don't help other countries, I mean, a pandemic cannot be fight on a country-based, like a management. It has to be like a global management. So that's why we have such a long pandemic. That we have new variants happening again and again, because, I mean, unfortunately, the standards on the high-income countries were not the same to the low and middle-income countries. That means that if you don't have a high testing capacity, if you don't have lab on sites on every province and remote location of the country, as we could be able to do in Galapagos, you are not going to control the pandemic. The virus is going to continue to spread, and new variants are going to happen, and that is going to eventually affect any other part of the world. So that's the turn. So when you need like a massive testing, not only for hospitalized individuals, but also for community dwelling individuals. So we found a bunch of positive asymptomatic individuals in the population included on the study, and also assist a remote location like a Galapagos Island with like a testing capacities setting on site. So that's the main lesson to be learned. Like more facilities for everybody and accessible and ready to go to control infectious disease is the only way to go.
Well, congratulations on that great success and on your article. It's fantastic to read it.
Thank you.
And best wishes. Thanks very much.
Thank you very much.